Kuzuzampala and welcome to Dungtsho BBS. I'm Sonam Chiki and I'm your host for today. For most of you who are planning on pregnancy and planning on having a baby must be really excited about motherhood. However, you must ask yourself, is my body ready as well? For today's episode, we are going to talk about prenatal care, and for that we have Dr. Pup. Thank you so much, Doctor, for coming on our show.
My name is Dr. Pup Doji, and I'm a senior gynecologist who has been looking after pregnant women for last 18 years and still working in JDW. And I have been, even in the past, been associated with the promotion of maternal health in Bhutan. It has been quite some time that since we were off the air, especially on this program with pregnancy-related issues. And today it is an honor for me to be here and talking with you.
So the first question being, what is preconception planning?
Preconception planning, in our Bhutanese context, it is quite in its infancy. It has not picked up well as it should have been. Preconception planning, actually, it is very important for couples who are newly married and who look forward to having a child. It is a time period where they should be seen by a health staff, not necessarily a gynecologist, but experienced health staff. And it's a time period that where they should be able to get screened. Screened in the sense that there are lifestyle modifications, like people who are taking alcohol, people who are smoking. This should be reduced because they affect pregnancy. People who have disease like kidney disease, heart disease and all, they also should be seen by a physician or a doctor, and their disease status should be brought under control. If they are taking any medication for their health purposes and they want to plan pregnancy, they need to see the doctor and change the medicine to a very safe one from a more toxic level to a safe drug. And if they have a higher body weight with obesity, these are the group of women who need to do some pre-pregnancy weight reduction program because it affects the pregnancy. And if they have any family history, either in the wife or in the husband, who has a family history of baby being affected, this is an opportunity during the pre-pregnancy planning that they should go and see the doctor and discuss and then see whether the risk is going to affect them or not. So it is a very important period. And if everything is done, and then there is one medicine to be taken in pre-pregnancy, we call it the folic acid, 400 microgram or 4 milligram every day. They should take before getting actually pregnant, at least minimum of 1 month before. So if it is possible, they should take at least 2 to 3 months before pregnancy and continue taking even after getting pregnancy for the first 3 months.
Yes, okay. So what are some tests to be done before pregnancy?
Now, if we look into the tests that needs to be done during, actually in the pre-pregnancy period, we recommend that all the couples, they actually should get their bloods checked, blood grouping, whether it is going to affect pregnancy or not. Blood grouping is very important, blood tests. They should check for sexually transmitted disease, because if it is present, it will also influence the baby. There's a chance to get baby can get infected. If it is there, they should be get treated. And that includes syphilis, hepatitis B, including HIV. These are the tests that they need to do. In addition, they should also check for their diabetes status, if they have, whether they have diabetes or not, especially for those who have families affected with diabetes. And for the women, they should get their pap smear status done. Pap smear should be done before the pregnancy planning, so that we know that during the 9 months of pregnancy, she will be at ease. So these are some of the tests that they should be doing. And provided that if they do not have a family history with affected baby, if they do have an affected baby, then they need to be, their blood also needs to be checked whether they are the carriers of some diseases.
Okay, as there are 3 trimesters, where does each one of them fall?
During pregnancy, we divide actually we say 10 months also, we say 9 months also. But for the sake of counting the pregnancy entire duration, if we count as 9 months, then it is each month has 31, up to 30 and 31 days. And here we divide the whole pregnancy into 3 months each. First 3 months is called the first trimester. And then the middle 3 months is the second trimester. And the last 3 months of pregnancy is the last trimester. Now, if you look on the 10-month scale, then it is each month is only 28 days. And 10 months will be a total of 280 days. So this is, when you talk about trimester, we talk about 9 months, 3 months, first 3 months, middle 3 months, and last 3 months. First trimester, second trimester, and third trimester.
What are some of the medications, checkups, or tests required for second and third trimester?
Second trimester, usually we check, second trimester is from 12 weeks to 28 weeks. So during this period, we recommend all the women to get checked for diabetes screening because it's mandatory. Or if the mother's age is very old meaning any pregnancy more than 37 years, we consider mothers as quite old. These are the group of women who has a high risk of delivering baby with problem. If they do want to really check for whether baby is affected or not, we have some non-invasive tests in Bhutan. We do ultrasound scan that is done at around 3 months. We do to check the baby's skin fold thickness behind the neck of the baby. This is called nuchal translucency. And that at 20 weeks, we check the babies with the ultrasound and check whether from head to toe overall body formation, whether it is normal or not. We can detect up to 70% of all the anomalies affecting the baby. This is called genetic scanning, or it is also called anatomy scan. One at 3 months for high risk, and then one at 5 months should be for all pregnant women. So this anatomy scan at 5 months is very important. It will tell whether the baby has congenital problems. That means problems while still inside the womb. In the third trimester, really we look at the test for the mother, because mother has developing the risk of developing high blood pressure, sometimes sugar. So we check for protein in urine, sugar in urine, and we also check for the mother's weight gain, whether she has adequately gained weight or not. We check whether the woman has adequate blood. We call it hemoglobin. So that there is one reason that during pregnancy the blood hemoglobin level continues to fall because the baby takes from the mother. So we need to replenish the mother's store by giving them iron supplement during pregnancy. So we also check their blood level, whether it's good or whether it's low. In addition, we also check for the baby. After in the third trimester, we need to make sure that baby is growing properly. So we check how big is the baby, whether growth is good or below the normal, and also the water with the baby, whether the water is enough or not. These are some of the tests that are commonly done in third trimester.
Doctor, you mentioned about pregnant women getting diabetes during pregnancy. Why is that?
Diabetes during pregnancy, because during pregnancy, God has programmed the woman's body that when she gets pregnant, she should not be selfish and use all the glucose and nutrients herself. So God has programmed her body that when she actually gets pregnant and when baby is growing inside, the sugar is very important for energy formation and metabolism of the baby. So mother's body is discouraged to utilize sugar. And then if mother's body is discouraged to use sugar, she will have high sugar level in her body, and that goes to the baby, and it's actually to help the baby. So it is a temporary diabetic scenario for the mother's body, favoring for the baby to grow during pregnancy. So there are many hormones that produce in the woman's body, discouraging her to use sugar. keeping her sugar level high and then baby growing normally. But in certain group of women who are predetermined, who has a family history of diabetes, whose families have diabetes and like grandmother, mother, or siblings, these are some of the women who cannot handle this temporary rise of blood sugar like other women. In their sugar goes really high.
Okay.
So this is a condition that we call it gestational diabetes mellitus. That means diabetes developing in pregnancy, and after delivery, this diabetes will go disappear, and then but in 5 to 10 years next, she has a high risk of getting actual diabetes. So we tell that woman who develop diabetes in pregnancy and disappear after birth, these women should be checked every year so that in the next 5 to 10 years, their diabetes, they have a 50 to 60% of risk of developing actual lifelong diabetes. So to catch them early will be good for themselves.
So what are some of the changes that happens to the female body during this period, during these 3 trimesters?
To summarize, in the first 3 months, when they get pregnant, firstly they lose their appetite. They don't feel like eating because when the woman gets pregnant, there are pregnancy hormones secreted in the body, and these hormones, they disturb the normal metabolism working of the body. So in the first 3 months, they will feel very tired and lethargic, and they cannot eat well. They don't like to eat. Appetite is down, and they may also get soreness in the breast tenderness, and they will also have a sense of frequent micturition, needing to go and pee frequently. These are some of the changes that happen in the first 3 months. But as the hormone is continuously produced, as the body gets used to this hormone, and they get better by the end of 3 months. And one important aspect is that on top of that, their inability to eat and loss of appetite in the first trimester, they also get a severe sense of vomiting. So this is as a body's maladaptation in the first 3 months to the pregnancy hormones. But slowly, in 80 to 90%, by the end of 3 months, the body gets used to this hormone, so they get better. By second trimester, in the body changes, usually the weight gain will be there, and then slowly, as the baby grows through this second trimester to third trimester, her body posture will change. The walking gaits will be a little bit different from non-pregnant, and her tummy will be bigger. So she will have awkwardness in both lying down, sitting, all this because of the tummy size. And then in addition, some of them might notice swelling of the body. This is due to pregnancy hormone retaining water. So these are some of the normal changes, body changes in pregnancy.
So how do we stay fit and healthy during this period?
Now, staying fit during pregnancy is important. One aspect is you need to take care of the diet. Some of the diet that we recommend is, though internationally they say that everybody should take a balanced diet, but in our context, because of our local settings, environment is not possible. But we encourage the women to take a mix of protein, carbohydrate, green vegetables, meats, at least round the clock in a week, so that they don't miss out. So healthy diet is important, and the mode of eating should be not in one big 3 meals, but it should be split out into small meals, 4 or 5 meals, well spread out. This will also help to reduce heartburn, where they feel that there's something burning in the upper abdomen, discomfort. This will help. So diet is very important, one aspect to remain healthy. Another is women during pregnancy, if they are not manually working, all the office, who work in the office and who have a sedentary type of lifestyle, they should have some program with exercise. It's very important. The best way to exercise in our setting is walking. So if you walk about 30 minutes per day, that is good enough. And you can do yoga. you can do dancing, but there should be no impact. All this should be, there should be no contact that gives jerk to the body. So you can do walking, swimming, yoga, and some dancing. These are some of the exercises to stay fit, including now we have in JDW, we have a program for prenatal exercise program. So this is a pelvic exercise they teach, so they can do this pelvic exercise also. It is important for them.
Now, how do we get ready for the baby? Any last minutes to do?
Getting ready for baby is now, I think most of our parents are educated, and there are books available about pregnancy and caring of the baby. Actually, during the pregnancy, we encourage both the husband and wife to come at all times together for the checkups. During the checkup, there's a session called health education. In that health education, many topics are included, including when they are pregnant, we discuss about how delivery will occur and what are the problems anticipated during delivery, and how to take care for a healthy baby and the life after birth. And then also we'll talk about family planning after birth. So it is actually an ongoing program. There is no split, like it is all happening together. We want to constantly remind the parents that there is going to be a modification in their life, and they have to accept that the baby is coming. And with the coming of the baby, they have to anticipate so many things. So I recommend everybody to read the pre-pregnancy, the prenatal books, which are available in our bookstore. In Thimphu also I have seen. And also, when they come, we encourage the husband to accompany the wife or the partner. And then they should ask all the questions before they come for the checkup. We recommend them to write down all the questions on the paper and bring to us, and then we can answer. And from our prenatal book, we have specific topics that where they will deliver, and during delivery, they should plan that who will accompany them, that whether their sister-in-law, mother-in-law, their mother, who is competent and with whom the wife feels, the woman feels comfortable. And then we also have during the checkup itself, it will discuss with them what clothes to bring for the baby. So it is already there in our handbook.
Where and why should a woman come for her delivery?
That's a very, very important question for all the women in Bhutan who are actually pregnant or who are potentially they will get pregnant in future. That women delivering at home, it has been a practice in the past. And it is a very dangerous, home is a very dangerous place for all the women to deliver. So we have even, our Royal Government of Bhutan has a policy that 100% institutional delivery. We want all the women who are pregnant to come to hospital for safe delivery. It's so important. In the past, by the year 2000 when I joined, the institutional delivery was only 15%. That means 85% were delivering at home. And we had many mothers who died in the process of delivering at home. Now if you look, the institutional delivery is around 65 to 70%. But still we have about another 25 to 30% to catch up. So my request to all the women will be that to please come to the hospital for delivery, because it's so important that during the process of delivery and immediately after birth, the bleeding kills mothers in Bhutan. So it is so dangerous that we have about 1 hour only after the birth, that if the proper steps are not taken by the trained health staff, that the woman can die. Within 1 hour after birth, they can die from bleeding. So it is so dangerous. And in addition, even if they don't die, there are a lot of risks of infection from unclean surface, unclean articles at home that will eventually affect the mother and the baby. So they will die from a delayed cause, from infection related. We call it sepsis. It's number 2 cause of death of the babies and mother for those who deliver at home. So it is very important that all should come to hospital for delivery.
The postpartum period, also known as after the delivery period, is an intense roller coaster ride for most of the women. So apparently this is a question asked to me by a very young mother. How long does it take for this depression to end?
After the birth of the baby, till the end of 42 days or 6 weeks, we call it the postpartum period. So after 6 weeks, most 99% of women are supposed to go back to the non-pregnant state. But for a few women who deliver and then they go into a sort of a unstable, irritable mental situation. So it is a bit of a stormy session for the individual mothers, especially so as you mentioned that whoever has asked you the question is a young mother. So it happens mostly in young mothers. It happens in mothers who have not actually planned the pregnancy properly, who have not actually read adequately or discussed enough for taking care of a baby. So that's why we recommend that all the mothers should come with their partners with a lot of questions and anticipate a full planning and discussion should happen. So for those women who are young, who are not very well prepared, and who also, and then there are other women, group of people who have some other social issues which are not favoring their marriage or there's a family problem. These are the group of women who, when they get pregnant and after delivery, they are at high risk of developing some mental illness situations. The commonest one, we call it the postpartum blues. This happens because after delivery, the pregnancy hormones I mentioned before that once the baby and after birth, the placenta, we call once this goes out of the body, there's a sudden reduction of the pregnancy hormones, and her brain and her body, there's a shock, little shock that they find it for adjustment. With the underlying social problem where she is not mentally fully prepared, where things are very happening with great anxiety, and then all these family problems will add on to this, and she will feel irritable, she will be very tearful, she will be anxious because she's not actually prepared well that how to take care of a baby. Suddenly from enjoyable single status, you become liable for a baby, and then you enter into motherhood with a lot of questions which are unanswered. So she becomes tearful, she becomes anxious, and maybe a sense of guilt. But this comes about 3 to 4 days after birth, and slowly by 2 weeks it should get all right. This is the lighter part. This is called postpartum blue. The other one is called the postpartum depression, where the woman feels very sad, low mood, doesn't feel like talking to people, always feeling guilty for having delivered a baby, and things are not very clear, and so social interaction is almost very low, suicidal tendency, thoughts come to her. This is called postpartum depression. And this will come from 4 to 5 days after delivery. It can go to at least 2 to 3 months. So even more than 6 weeks it can. But the longest, by end of 6 months, it should not be there. So if anyone has this problem, if any family relatives notice that their daughter or wife is not responding well, is meant to mood down, they need to bring to hospital for screening, because we have medicines to give to like those persons to elevate their mood and talk to them, get things straightened, so it will help them to recover faster. And the third one is the more serious condition is called postpartum psychosis. In postpartum psychosis means it develops about 4 to 5 days after delivery, and it occurs in about 1 to 2 per 1,000 women who delivered. And they start to hear sounds. This is called hallucinations they see. Then they see sudden objects like delusion. And then they have a behavioral problem. They go into manic state. Manic means they're very agitated. They can harm other people. They can kill their own baby. They will not listen to what they say. So delusions, hallucinations, manic expressions, postpartum psychosis. This is the most severe part. We do get 1 or 2 even in our hospital in Thimphu, but we help them with the medication. So anybody, any woman who develops like these conditions, like who are tearful and all, the postpartum blues, without treatment they will get all right. Those who have depression and not go into really down, they need help. And postpartum psychosis, immediately they need psychiatric help, so they need to come to hospital. We have medication, and all these conditions will ultimately get better by 6 months. And psychosis, it may remain as long as up to 1 year also. But with medication, things will come back to normal. So these are the 3 mental situations that may develop in the postpartum period. So I would like to request all the pregnant women and the couples that you need to talk and you need to support the pregnant woman. The family needs to support her so that she is brought up in the environment that is very comfortable, encouraging. So this is the remedy to reduce this type of incidents with mental illness in the immediate postpartum.
Are all the women liable to get this kind of depressions?
Everybody is liable to get depression, but it's not that all are susceptible. Everybody has a chance to get this illness. But who actually develop are the ones that I mentioned to you, that who has a family problem, who has a social problem, who has a marriage problem, and who have thousands of unanswered questions, who has no proper income after birth, no proper planning, with the career, all conflicting. These are we call predisposing factors and precipitating factors. So these are the group of women who are likely to have this situation. Those group of women who has these predisposing and precipitating factors. Yeah. So not everybody has a chance to develop, but then it is actually it is limited to who has other problems underlying.
Yes. And what care should be given to the mother after the delivery?
Now, care to the mother specific after delivery is over. We recommend that mother should come for checkup at least in the 1 week after delivery. And those who cannot reach the hospital, who deliver on the way or at home, they should immediately come within 24 hours for checkup. And then for first week, then 3 weeks, and then 6 weeks, we ask the mother to come for checkup. So during those, we want to see that mother is coping up well with her baby, breastfeeding issues, whether her dietary, whether she has gone back to a normal diet, whether she has any infections have been developed or not, and how well she is coping up. And then that is the time period she needs to intensely do the pelvic exercise. And nowadays, with our royal government's kind gesture that we have 6 months of maternity leave, so we encourage all the mothers to have exclusive breastfeeding in this period. So we have to encourage that postpartum period focus shifts from the mother mainly to taking care of the baby, with exclusive breastfeeding support should be given by family member, health workers, everybody, so that we have a healthy generation later on.
So doctor, any advice to the viewers or anything that you want to add on?
I would like to say that to all the viewers that nowadays we are seeing a shift of change in the women who get pregnant. The women are getting pregnant little later than in the early 20s. The shift has more towards that they're getting pregnant first time in the 30s. And we are also seeing that most of the women who are pregnant these days, they are working, they are professional, they have a career. And to make your pregnancy very successful, it is so important now. All of the young women who are anticipating pregnancy should come and take the opportunity of pre-pregnancy counseling, pre-pregnancy plan making or decision making, plan your whole pregnancy before actually you become pregnant. And then there are a lot of lifestyle modifications, diet modifications, including taking folic acid before you become pregnant, continuing that folic acid to the first 3 months of pregnancy, and then following up as advised when you get pregnant, and then bring all your questions in writing and ask the health workers. We would like to see that every pregnancy should end into a healthy take-home baby and a happy ending.
Yes, thank you so much, the doctor, for your time and effort. This talk was a very informative one, and I'm sure that our viewers feel the same way. Thank you for watching.